Hello, everybody. I wanted to share a case that I'm looking at on one of my patients, and I showed cases like this in my AAO webinar last February. Feel free to watch it. I don't get paid per watch. Um, but I think this Clincheck came back showing something that is not realistic, and I have a different plan for this type of situation. You can see, and no, I'm not showing the full records, but you can see prior 4 by exo with, I guess, what we would call over traction, lack of torque. We have a crazy curve of speed. Maybe this guy lived in Australia in the outback and had big treatment, who knows? But now his complaint is that his bite feels uncomfortable. He's chipping his lower teeth, and he wants some improvement and also more presence in his smile. So the Clincheck comes back, and the first thing, we know we want to improve the inclination of the upper anterior teeth, and the Clincheck comes back. I've talked about this before, and what you see here is palatal root torque, which does give an improved inclination of these upper anterior teeth. So at a glance, this looks nice, and there is some kind of lifting and crown tipping or buccal crown torque. But notice there's no space that is opening up in the extraction site. And that's because I didn't ask for there to be any, and maybe the Clincheck default assumes that the practitioner doesn't want there to be space opened up. But the issue here is that to get this type of effect requires a lot of palatal root torque, and that is just not realistic. It's tough, even in my opinion, with braces, because yes, you can cinch the wire and do all kinds of torquing mechanisms, but remember, the palatal roots are close to the palatal cortical plate. The teeth usually have a large column angle, and there's resistance to doing that. So I'm going to show you how I modify this and kind of my approach to the whole case overall, because the lower has an issue with it as well. So now I put on the modify button, and I don't want to have that palatal root torque. I don't need the palatal root torque because the crowns are lingually inclined. And so I'm going to take the root torque tool, I'm going to push this kind of towards where the teeth are now. See that? And go back here. Now I have more of a pure tipping movement, which is much more realistic. And then let's look at the laterals. A little bit here. A little bit here. I'm going to look at my canines. And so what I'm going to do is, the previous extraction, I think, created more space than needed, which happens quite often. Now, I don't feel like I need to be bound by that. And this person might even need some new crowns. So I'm just going to open this up, maybe, let's just say 1 millimeter, which is going to help with my proclination, because remember, the crowns are over retracted. Okay. So now that movement is, to me, more of a realistic movement. Now, I know you're thinking, well, you opened up space. Well, it was overclosed, in my opinion, and I can explain this to the patient. Now, in the lower arch, so now I get a lot more overjet. In the lower arch, similarly, look at how the curve of speed is leveled with an intrusion that is not accompanied with any facial crown torque. So that's not a natural way. You understand with wires and brackets that there's going to be some component of, okay, that looks not as much lingual root torque as I would have thought they added. Let's see. more tipping, and then my canines, which obviously were over retracted. I'm going to open up space here. So that's going to make paralleling those roots easier. All right. And then in terms of the degree of intrusion, you always will end up with sort of an illusion of a massive overjet from that intrusion. But I think that that is a little bit of a virtual sort of artifact. So now, to me, opening the bite is going to be a lot easier because I have more relative intrusion that comes along with crown proclination. And the space that's there, he can get crowns on the premolars, he can get bonding on the lateral incisors, and I think this is going to be an easier way to get a more profound treatment effect if we're looking to get rid of that extreme overclosure in a sense, or over retraction and wear on those teeth.